In this video, we're going to be talking about glaucoma. What is it? How does it work? Why does it cause vision problems? And what there can be done to help correct any issues with it. By definition, glaucoma is a group of diseases that impact the optic nerve, the structure in the back of the eyeball that looks like an orange donut that connects to the brain, but can cause multiple vision issues that are connected with multiple conditions. The symptoms can start so slowly that you may not even notice what occurs with your vision when glaucomatous vision changes take place. Tunnel vision, loss of peripheral vision, blindness. A bunch of scary things can happen if glaucoma is not detected early enough and taken care of and treated appropriately. The only way you can truly find out if you have glaucoma or if you are suspicious for having glaucoma is to be examined by an eye care professional. Optometrists, ophthalmologists, healthcare professionals of that nature look for glaucoma regularly. With glaucoma, you can have different variations and different types and different styles. So what are the different types and styles of glaucoma? We're going to start with the primary glaucomas, or the primary sector of glaucomas. This can include something called open-angle glaucoma, which just means that the anterior chamber angle located at the junction of the cornea and the iris kind of makes like a V shape. That's open, but it's still causing damage to the optic nerve. It is actually the most common type of glaucoma in the United States, where 9 in 10 people with glaucoma have the open-angle type. Unfortunately, many people don't notice symptoms until their vision starts to decline or deteriorate or go totally blind. You can also have normal tension glaucoma, which means that eye pressures are actually normal in this case. Experts are not really sure, and we as eye care professionals are not sure what causes normal tension. We are not sure what causes normal tension glaucoma. This is still being researched and still heavily investigated to determine what other risk factors can contribute to normal tension glaucoma. You also can have what's known as angle closure glaucoma. So we talked about open angle earlier. Now we're going to talk about closed angle, which means that the anterior chamber or the front of the eye has closed and not allowing the aqueous humor to drain effectively out of the eyeball, because that's another risk factor. Is if you can't get the fluid that makes up the eye pressure out of the eyeball, known as aqueous humor, that eye fluid will back up, and it will cause the eye pressure to overflow and increase in magnitude and severity, putting damage and pressure onto the optic nerve. Some of the things you want to look out for when you experience an angle closure event or angle closure glaucoma include intense eye pain, upset stomach, like you want to vomit into a bucket, red eye, or blurry vision. There are certain laser and surgical procedures that can be done, and even medicinal procedure, or there are certain medicines as well too that can open up the anterior chamber of the eye to allow the fluid in the eye, the aqueous humor, to drain more effectively. You can also even have congenital glaucoma, meaning that the optic nerve or optic nerves, because it can happen in one or both eyes, have been damaged since birth. And there are several surgical procedures and methods that can be done to help take care of that. The eyes are cloudy, whether they have light sensitivity, they may create the child may create extra tears in their eyes, and they may even have eyes that look larger than what's considered normal. Those are the primary glaucomas. What are the secondary glaucomas? Well, some secondary glaucomas can include what's known as neovascular glaucoma. This is what happens when new blood vessels grow onto the iris of the front of the eyeball and actually start shortchanging it. But you can also have new blood vessels growing in the optic nerve, in the retina, in various places in the eyeball that actually start to starve the structures of oxygen, and actually blood vessels that are doing things that they don't need to be doing. Painness or redness in your eye can be a factor of that, but also vision loss can be a factor in this as well too. Something very specific we like to watch with neovascular glaucoma is when someone has what's known as a central retinal venous occlusion, or a blood vessel of a vein getting clogged and blocked in the back of the eyeball. We call it a CRVO. This is often affiliated with what's known as 90-day glaucoma, meaning that if the central retinal vein occlusion is not cleared up and if treatment is not being done or taken care of, then that can actually increase the risk for neovascular glaucoma significantly. You can also have what's known as pigmentary glaucoma. This means that pigment builds in the front of the eyeball, clogs up the trabecular meshwork, which is located inside the anterior chamber angle. And the trabecular meshwork works like a bathtub drain. It's little holes scattered all the way around that drains the eye pressure fluid out. But if those bathtub drains get clogged, again, like the angle closure, the pressure will build and things will get backed up and the eye pressure will skyrocket, and it can cause a lot of visual problems and leave permanent vision damage. You can also have exfoliation glaucoma, as material is depositing on the certain sections of the eyeball, and like pigmentary glaucoma, the eye pressure fluid can't drain effectively. You can also have uveitic glaucoma, which happens when someone has a uveitis, an acute inflammation or a chronic inflammation into the front of the eyeball, or to the back of the eyeball, or to the middle of the eyeball, depending on the location of where the inflammation is at. Other risk factors of glaucoma can include cataracts, can include age, can include ancestral background, things of this nature. It's a very scary condition that we like to watch a lot of times for in patients to make sure that we're staying on top of things and get patients either treated, whether it's with medicine, eye pressure lowering drops, whether it's getting the patient seen by a specialist, whether it's an ophthalmologist or glaucoma specialist or anything in that ballpark, to get them treated with some type of surgery or laser treatment to make sure that the eye pressure fluid is draining appropriately and that things don't occur and will continue forward to cause the patient visual issues.
You can even get a form of glaucoma known as traumatic glaucoma. This can come from a car accident or something that shot into the eye, whether it was a firework, some type of ball, or anything that's kind of penetrating to the eyeball. So if you're doing anything that you need protective eyewear with, please wear your protective eyewear, because if you don't, you're putting yourself at risk for developing traumatic glaucoma that can significantly cause permanent vision loss and alter the vision the rest of your life if not taken into careful consideration. Maybe working with metal, or you may have something to do with construction or things where particles of debris can fly into your eyes and cause permanent vision damage. So again, please wear your safety eyewear and keep your eyes healthy and safe.
Biggest takeaway from glaucoma is that make sure you get your eyes checked by an eye care professional, because we look for this stuff regularly when we examine patients to make sure that patients are not going to be at risk for developing glaucoma. And if they are, then there's steps that we can take to be more proactive about taking care of the health of the eye rather than dealing with it later and having been dealt with permanent vision damage and loss as a result of that. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington, and we'll see you next time.